The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and we're glad you've joined us today. We're going to be talking about something that is afflicting millions of Americans and many people around the world, and that's type 2 diabetes. Joining us to talk about this subject is Dr. George Guthrie. He's a physician at the Lifestyle Center of America in Oklahoma that deals with these types of things, with lifestyle diseases. He also is one of the founding physicians in a program called Wellspring that deals with the same thing. He has practiced medicine for about 14 years in a family practice setting. He's also taught in the university, at the university level, subjects like nutrition as it relates to health. And we're glad you're with us, Dr. Guthrie.
Glad to be here, Don.
I'm excited about the different things we're hearing about the hope and help that can come to the millions of Americans that have diabetes type 2.
That's right. It's encouraging.
And I guess you do this day in, day out. You really help people all the time.
Yes, it's exciting to see people actually changing their disease process.
Now, we talked a little bit about diabetes on other programs here on Health for a Lifetime. One type of diabetes is type 1, which is an autoimmune situation that really you can't do anything about except for treat with medication, or there are some new approaches that they're still implementing with transplant of cells and whatnot. But this is type 2 diabetes. What is type 2 diabetes? What causes it? What can we do about it?
In order to understand type 2 diabetes, we need to understand how the Creator designed us in the first place. So let's review a little bit and then kind of explain how it comes. We take food in our mouth that goes down into our stomach. That little sac, which kind of mixes up the digestive enzymes and gets things started. It then goes into the small intestine and absorbed into the bloodstream. The bloodstream takes the food, the energy that's coming into the body, in a variety of different places. One of the places it goes is the pancreas. And there in the pancreas are cells. They're called beta cells. Their job is to make a hormone which I like to call the Paul Revere hormone. Remember what Paul Revere said?
The British are coming.
Right. Well, insulin says the energy's coming. To let the body know. That messenger goes out throughout the whole body, and the cells of the body then hear that the energy's coming and open up to receive the energy that's coming. So that's the way the system works normally.
And then what happens when you've got a problem? Paul Revere falls off his horse? What happens?
No, it's not Paul Revere falling off his horse this time. In essence, it has to do with the listening ability. You see, each cell in our body responds to that insulin according to its own need. You can imagine if I were running a race, the thigh muscles, as I'm running, need a lot of energy. Okay. And when the energy comes in, the Paul Revere hormone says the energy is coming. The cells of the thigh muscles say, I want it, give it to me. On the other hand, your eye blinkers, the ones that are kind of cleaning the windshield, don't need all that much energy. So if I'm running that race and all that energy comes in, the Paul Revere hormone says the energy is coming, the eye blinkers say, hey, I'll take a little bit of it. So there's an individual variation really among all the cells of the body. A relative insulin sensitivity versus a relative insulin resistance. Now, you asked about type 2 diabetes.
Right.
Here's what happens. If there's too much energy in all the time, coming, and no energy out, no exercise, the cells get full.
We don't need that anymore.
They don't need it individually, like the eye blinkers, which say, maybe I'll take a little bit of it. The rest of the cells begin to say the same thing. When the thigh muscles, or most of the cells in the body, are saying, no thank you, then we begin to see the changes that lead to type 2 diabetes.
Okay, so this then, they resist because there's so much insulin out there they just don't need it.
Exactly.
And then what happens?
What happens, the body knows that too much sugar, too much energy in the bloodstream will tend to cause problems. Now, I think we've mentioned these before. There can be problems. One of the graphic that we looked at, I think we have one that we can look at. Small blood vessel diseases are caused by blood sugars that are up too much, too long. And so the body tries to keep those that from happening. If there is for example, the blood vessels in the eyes are kind of plugged up by too much blood sugar, it leads to blindness. Same thing could happen in the kidneys or in the nerves to lead to neuropathy. The body, knowing that, says we've got to get this energy out of the bloodstream. And so it starts to yell louder.
Okay, so the real problems then, and we talked about those with the sugar going up, is that it really causes damage in these small vessels, and they say, hey, get it out of the bloodstream because we don't want the person going blind, and we don't want that happening. So where does it go?
So what happens is the pancreas just yells louder. The Paul Revere hormone keeps coming out. The energy's coming, the energy's coming. And that higher and higher, well, that increasing levels of insulin kind of force the cells to take it.
Okay.
But they are developing something called an insulin resistance.
Insulin resistance.
And when most of the cells in the body have this thing called insulin resistance, then we say that the whole body has insulin resistance.
I think we have a graphic that shows a little bit of the physiology. We want to look at that. Is this, I assume, is the stomach, and it's going down in there, getting churned up, and then supposedly going down into the intestine. What's happening here?
Well, it's absorbed into the blood vessels. Some of the blood vessels go to the pancreas, which then respond. The beta
and is
cells.
that little finger-like thing off the stomach?
Yeah, it kind of sticks behind the stomach. You can see part of it over there to the left, and then the little finger that sticks out.
All right.
And then the insulin goes out and really sends the message to all the cells in the body.
Okay, and then when that's messed up, just like you described, we get insulin resistance.
The cells don't want it. They're saying absolutely not. We see the insulin levels going up. As the insulin levels go up, it begins to cause problems in the body.
What are the problems it causes, and what should we do to treat them?
Okay. The first one I'd like to put up on the list is actually obesity.
Obesity.
And that's because insulin is a growth hormone. When your insulin levels go up, it tends to make you store energy. So not only do you tend to store fat energy, but you also tend to kind of build up, increase proteins in the body as well. One of the common things that happens to me in the office is a young man will come in, well, I say young now, so let's say 45 years of age.
That's young, very young.
Thank you. He says, you know, Doc, I'm having a hard time getting the weight off. I put on 30, 40 pounds. When I was young, I was a jock. Football, track, field, whatever it may be. I gained a little weight, I just exercised and it would come off. I graduated from college, I got a desk job, and I still try to do the exercise, but you know, my weight would go up a little bit, I'd exercise and it would go back down. Well, recently, it's not working. My weight is still going up.
So this clicks in your mind while he's not processing the insulin and all that stuff correctly.
He's developing insulin resistance. His insulin levels are going up, and that's making it hard for him to lose weight.
So someone that's happening today that's listening, they need to check out whether or not they have...
If it's hard to lose weight, it's likely that your insulin levels are starting to go up. If the insulin levels are going up, you're on the road to developing that diabetes.
Is this something that you should go immediately see a physician about, or is it something you can wait a couple of years?
Let's wait till we talk about the treatment.
Okay.
Okay?
What's another thing that happens then?
High insulin levels are also strongly associated with elevated blood pressure.
Okay.
I've seen reports in the literature taking people with hypertension, 90% of them have elevated insulin levels. Now, insulin, we're not 100% sure of the cause and relationship here, but we know that insulin tends to make the kidneys hang on to sodium. And sodium pulls water in. If there's more water in the pipes, the pressure tends to go up. Also,
So high blood pressure is related to diabetes. I mean, I haven't heard this too often, and you're saying that happens as a result of...
the elevated insulin levels.
All right.
You see the body's getting insulin resistance. The insulin resistance, the body's overcoming that by increasing the insulin.
Okay.
As the insulin goes up, it tends to hold on to the sodium, and the insulin resistance itself makes the blood vessels so they're less stretchy. That is, they tend to be a little narrower. Smaller pipes and more water in the pipes tends to make the pressure go up.
All right.
Something else elevated insulin levels do is to actually raise cholesterol. High insulin levels make the cholesterol go up. That includes the bad cholesterol, the LDLs. At the same time, it tends to make the good cholesterol, the HDLs, go down.
How does that work? Why does that happen?
You know, I'm not sure the mechanism on that, but it's pretty direct.
So they always see this. When the insulin goes up, cholesterol goes up, HDL goes down.
That's right. The insulin, as it raises, has this effect. And put those effects together, and you have a setup for something called heart attacks, right?
Mm-hmm.
So we're kind of building a case here on the way to type 2 diabetes, actually a series of diseases that are coming secondary to the insulin levels going up. We have increase in weight, we have increase in blood pressure, we have increase in cholesterol, and heart attack risk.
So increase in weight. So for 3 or 4 of them. Someone I was talking to once called these for the deadly quartet.
That's one of the names for it, yes. Sometimes it's called the insulin-resistant syndrome because it's insulin resistance that's actually causing these things.
So if anybody has a duet, a solo, or a trio happening, it's time to get to the doctor, right?
Well, it's time to do something about it for sure.
Are we ready to talk about what we can do about it?
Okay, we can do that. It's really not that difficult. If you understand that the cause of the disease is actually from too much energy in and not enough energy out, exercise, then the best way to deal with it is to turn that process around.
So exercise is one thing we can do.
Exercise and decrease the number of calories coming in.
What kind of exercise is the best?
Anything that uses the muscles.
Well, that pretty much opens it up. What kind of things do they do at the Lifestyle Center? What kind of things do they recommend in the Wellspring program?
Well, there are a lot of different kinds of exercise, and it can be talked about in a lot of different ways. You need to move, for number one. The antithesis of health is the couch potato, right? Who's sitting there doing nothing. You know, you get credit for the exercise you do when you just get up and walk, right? A little bit.
Right.
Parking at the far end of the parking lot so you can walk forward. But, you know, you ask about specific forms of exercise that might be beneficial. And again, I want to emphasize any exercise is better than none. At the Lifestyle Center of America, we believe that something called intermittent training, usually used in high Olympic class athletes, modified for people with these diseases, diabetes, hypertension, obesity, heart disease, is actually a better way of exercising.
So intermittent, does that mean you stop and start?
Yes. Our little rule is every minute that you exercise needs some rest within that minute. So, for example, in my exercise program, now that I've learned how to do it, I'll exercise hard for about 45 seconds and then rest for 30 seconds. And then 45 seconds really hard and then rest or slow way down for 30 seconds.
So it's okay for me when I'm out there running and I see all these cars coming by and I say, man, I wish I could slow down. I should just do it instead of just saying,
it's not a bad idea.
Just keep going because they're all coming and they're going to think you're a wimp. You just keep going.
You've kind of gotten me moving over towards the exercise side of things, but let me focus on the intermittent training.
Okay.
We really think it works well because it keeps lactic acid out of the blood. Lactic acid is a toxic sort of a substance that tends to make the cells sick. Well, you know, if you push it too hard, your muscles are sore. Lactic acid tends to decrease your pleasure from your exercise, and especially for people who are sick, makes them, they don't feel as well. If we keep the lactic acid out, they can actually improve faster. So that's an important part of our treatment program, and certainly taught and recommended at Lifestyle Center of America, as well as the Wellspring program available for people in their homes.
We've been talking with Dr. George Guthrie. We're talking about type 2 diabetes. We're going to be getting some more practical suggestions on how to stop, reverse, or probably better yet even than that, prevent this disease when we come back. We hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. George Guthrie. We've been talking about diabetes type 2. And this afflicts millions of Americans, and we've been learning some exciting things as we've talked about how the disease works, or should we say it makes your body not work, Dr. Guthrie.
Right.
And you've done a lot of work in this area. You work at the Lifestyle Center of America in Oklahoma, where I think they have in-home treatment programs or in-house treatment programs there. And then also there's a new program developing. You told me a little bit about the Wellspring program that people can even have in their own community. What kind of things, we talked about what causes diabetes. We talked about how, we have insulin resistance. We have a problem with the pancreas ultimately starting to shut down. And then we started to talk about reversing that. And we had talked about weight and how we want to exercise to reverse that problem. What other kind of things can we do to be reversing diabetes type 2?
You remember the cause of the problem is too much energy in, that's food, calories, and not enough energy out, that's in essence exercise. And we focused a bit on the exercise. Why don't we pull over to the food side here for a little bit?
Okay, so we're out there exercising, now to what we eat.
When we eat, if we take a lot of calories in all at once, and it hits the body like a truck, like a wall of bricks, it's really quite a strain. All that energy comes in, it hits the pancreas is yelling, the energy's coming, the energy's coming. A lot of insulin goes up. We've talked about already, as we've talked about the cause, that when the insulin is high, it tends to make the weight go up, tends to make the blood pressure go up,
the cholesterol.
And the cholesterol, all that stuff. So if we can take food that doesn't stimulate as much insulin production, we'll actually be helping the process. Does that make sense?
Now, that makes sense. Speaking of food then, does that mean we should just eat less food?
Well, that would be one way to do it. But if one chooses food that is lower in calories and larger in volume, one doesn't have to decrease the amount of food.
They can even eat more food.
That's happened, exactly.
So what should be in the food we're eating? You said decrease the calories, but the volume. How would I do that? Does it have a knob? I turn up the volume?
or maybe a better question is, where in the grocery store do I find that aisle?
Right.
Well, the best place is actually in the produce section. The way God designed food, it didn't have the calorically dense nature. It has mixed with it a lot of fiber and water and other important things. So generally, the rule that we use at Lifestyle Center of America is move toward a plant-based diet. The closer you get it to the way God made it, the better.
So mangoes and mashed potatoes instead of M&Ms.
Well, certainly, mangoes would be better than M&Ms.
All right, so just more fiber. Anything else about food we need to know as we're trying to reverse type 2 diabetes?
Well, when we talk about the fiber, one of the encouraging things about fiber is that it works in other ways that are beneficial to the insulin resistance, to that stimulus to the insulin. What the fiber tends to do is hang on to the energy and let it go into the body more slowly. If it goes in more slowly, the pancreas doesn't have to respond so emotionally, so vigorously, okay? It can, okay, we can handle this, and there will be less insulin. If there's less insulin, then there's less stimulus for the weight gain, etc.
Okay, we talked, so exercise, first of all, we talked about, and now we've talked about how to deal with the weight problem from in terms of what we eat. There were other things that we saw on our graphic that caused or came as a result of type 2 diabetes, and the next one on our list, I'm trying to recall what that was. We had, what was the next thing?
We had obesity, hypertension, and the heart disease.
Okay, so heart disease, let's talk about that then, or hypertension.
Now, they mean how to get the hypertension down?
Right.
Well, since the insulin tends to stimulate or the holding on of the sodium and tends to make the blood pressure go up, if we can lower the insulin levels, why the blood pressure will tend to come down as well.
So just kind of, it's a natural thing if we're moving, if we're eating the right things. What other things do we do then, or do you do there at the Lifestyle Center of America or in the Wellspring program to reverse type 2 diabetes?
Well, it's really simple. It's the exercise and the diet. One of the things we focus on is something called the glycemic index. Have you heard of this?
I have not really heard about this, no.
It's a rather interesting concept. Scientifically, we can actually measure how fast the energy comes into the body. Measure the speed of the freight train, if you want to put it that way. So when you eat a food, how fast does it actually enter the bloodstream? The measurement we use is called the glycemic index. Okay. In essence, it's a percentage. You take 100 grams of sugar or 100 grams of white bread, you measure somebody's blood sugar when they eat that, and it goes up and it comes down. You measure that under the curve, you call that 100%.
Okay.
Then you give somebody 100 grams of broccoli, and the blood sugar goes up just a little bit. And you measure area under the curve, and then you say, well, that's a percentage of the 100% of the either white bread or sugar. And that then creates something called a glycemic index.
So you carry a glycemic index with you and say, okay, that's going to make it go up, I don't want that.
Well, it certainly helps to answer questions when people look at foods, and there are lists of foods to help people with that. But the truth is, the closer you get it to the way God made it, the better off you are. For example, if you look at the glycemic index of, we mentioned already, white bread. It's wheat that has been highly refined. It goes into the body really fast. If you look at the whole wheat, it goes in quite a bit slower. If you take the fiber out, it goes in faster still. If you grind it up into powder, like the flour, it goes in very fast. If you eat it as wheat berries, it goes in even slower.
So same thing would be true with rice, white rice versus
Exactly.
brown rice?
Uh-huh.
Okay. Okay, so the glycemic index then, this could be something that would be handy, but basically if you don't want to carry anything with you, just eat foods in their natural state and you're going to be okay.
Foods as grown is a good principle. The closer that you get it to the way God made it, the better off you are.
Honey? What about honey?
Well, honey has a lot of sugar in it, and
it's a processed food for the bee, huh?
A processed food from the bee, that's correct. And this brings out a good point, Don. It's not that you can't eat foods that are higher in glycemic, but your meal should be composed largely of foods that are low on the glycemic index. So, for example, you could have a little honey with some sort of a whole grain as a sweetener, because the fiber helps to modulate that. We eat whole meals. We don't usually eat plain foods. As a matter of fact, there's been some argument among those who work directly with patients about how useful this whole glycemic index is, because who wants to go around with a list?
Right, with a list, yeah.
So, in essence, it is a tool to help people begin to think about foods that are safer and better.
Okay. You know, in speaking about treating type 2 diabetes, have you, at the Lifestyle Center of America and also in the Wellspring program, have you seen success? Can people reverse this disease? Do they get off insulin? What kind of things happen?
Oh, Don, I'm afraid of that reversing disease word. Okay. When you talk about reversing the disease, that's a little scary to say. For example, if somebody has blindness from the diabetes, I don't know that I can reverse that.
Right.
The amputations, kidney failure, I don't know that we can reverse that. But what I have seen happen is I've seen blood sugars come down, I've seen insulin levels come down, blood pressures come down, weights come down. In essence, this whole problem associated with high insulin levels is, I'm afraid to say that word, reversed. It's backed up.
It's stopped at least.
It's
it doesn't
stopped.
go further.
It's not going further, and in many people it actually, reverses.
Okay. So that's good news. It also means that if someone's watching today and they have that increase in weight, increase in blood pressure, increase in cholesterol, all those different things, it may be diabetes, then they should get on it as soon as possible.
If their blood sugars haven't been found to be elevated, it's probably with those 3 or 4 things going on, at least pre-diabetes. And those we know we can reverse. Those reports are in the literature. So if you catch it when it's kind of its pre-diabetes state, then you can really do something about it by decreasing the amount of calories in and increasing the amount of calories that you're expending, i.e. exercise.
Some people say, I can't control my will, what I will do, what I won't do, so give me a pill. You know, something like that. That really, it sounds like, is not a good approach. I mean, the medications, and what role do they play or not, or should they not play?
Well, you already know from our previous discussion here that raising the insulin levels by giving insulin shots may make things actually worse, because high insulin levels are part of the problem. Same thing with medications that kick the pancreas. Make more insulin, make more insulin. It's kind of the same problem. We do have some medications that tend to decrease insulin levels. Those make sense and may be helpful.
Some provocative things you talked about I never heard about before, magnesium and iron. We have about a minute and a half. Tell me a little bit about these.
Oh, Don, it's hardly enough time. The average American is low in magnesium. If we can increase the magnesium in our diet, in our body, in our cells, and it's the intracellular magnesium, not the blood level. The blood level doesn't correlate well, but intracellular magnesium, if it goes up, it increases the energy that the cells use, and if you replace that magnesium, you actually tend to see the parameters of diabetes and this whole syndrome improving.
Real quick, foods high in magnesium.
Plants.
Plants, anything that's a plant.
Generally, you remember chlorophyll? When you learned about it in high school, the central little element in the middle was magnesium.
Okay.
So there's a lot of it in plants, and it's very deficient in animal products.
So pull over right now and eat some plants. What about iron?
Iron. Some interesting data coming out. Increase the iron, you increase the insulin resistance, you tend to make the cholesterol go up. Meat diets tend to be high in iron, especially the red meat. They tend to make this whole process worse. There's some interesting studies demonstrating that people who donate blood on a regular basis have fewer heart attacks, lower cholesterol, and less diabetes.
So less iron, basically.
We don't have to worry about it as we get older. When we're younger and growing, if we don't get enough, it causes problems with learning. But as we get older, we tend to store it, and too much iron is more likely to be a problem as we get older.
So watch that. Oh, that's interesting. So, you know, there's either side of that, because when you're young, you certainly don't want to be recommending no iron for some people, depending on where they are in life.
Right.
We've been talking with Dr. George Guthrie. We've been talking about diabetes and how to stop it, prevent it, and perhaps even reverse it. If you'd like more information, give us a call. Thanks for joining us on Health for a Lifetime.